I'm Hannah Tarr and I work as an advanced physiotherapy practitioner within the Hywel University Health Board in the CMAT service. So CMAT stands for the Clinical Musculoskeletal Assessment and Triage Service, and we're a team of advanced physiotherapy and podiatry practitioners. We will assess those with quite complex musculoskeletal needs and develop an appropriate care pathway through secondary care to tertiary care services as appropriate. Prior to the COVID pandemic, we had no digital services. We would only offer a face-to-face clinic. There was no telephone consultation or video consultation, so this has been a whole new way of working. We had to adapt a new way of working quickly because once the lockdown happened, all face-to-face services shut, but yet patients were still getting referred into our service and still had needs that needed addressing. So initially, we were addressing those through a telephone consultation as appropriate, and then once the Attend Anywhere video consultation was available, then we were quick to make sure that we could also offer that as a way of managing our service. Challenges with video consultation for both staff and patients were to get them on board with the service to start with. It's a very new way of working, so obviously some people were apprehensive about it, but once we were working through it, people soon began to realise that actually is quite an effective way of delivering a service. There's been some challenges because it's a rural health board and the broadband, so maybe some people didn't have access to the IT, but we could overcome that. Being able to make that eye contact with somebody via a video screen was far more reassuring for us. We rely on a lot of visual clues when we're assessing somebody. So I feel that the staff that were involved in the assessments did find that it benefited their clinical reasoning. We felt far more confident in the decision-making process for each patient. So if anybody was thinking of using video consultation as part of their clinical role, I would definitely encourage it. For us, it's been time-saving, it's prevented patients travelling into hospital. There's no limitation to space, so it can be used anywhere. Also working from home, if it's appropriate at the moment, that could be arranged as well. So it's definitely got a future moving forward.